So my view of psychosocial medicine as an attending is that it's invaluable, absolutely invaluable. When I started as an attending, there was one behavioral health consultant who was on, which meant that behavioral health consultant also took vacation and had other responsibilities and was not always there. And I feel like I did my best because I didn't have the resources available. And then we had another behavioral health consultant come on, and then two others joined, so we have a complement of 4. And it was amazing, the ability to be able to work as a team and to be able to really see my patients' lives transform in terms of that. I feel like I was able to learn skills through my residency, and I'm still learning skills from the behavioral health consultants as I work with them. But in terms of, I only got 15 minutes to see a patient, and in that 15 minutes, I do need to be able to manage their diabetes and manage their hypertension. And I can open the window of, let's start talking about what are the barriers to the management of, what is the problem with taking the medications, or, why can't you pick them up, and what else is going on in your lives. And it's nice to be able to have somebody else to put our heads together and formulate a plan about, this is why the patient is acting this way, or this is why the patient can't pick up their medications, or this is what's affecting their lives. And so it really alters what I'm doing when you have a completely different perspective in terms of the foundation that I was talking about of, why are we going to do what we're going to do and how it's actually going to benefit the patient, rather than it just being what I think the patient needs to do. I think that one of the selling points that I have with the patients is that, because they'll be like, well, I don't need to see a shrink. And so I tell them, well, I do, or everybody does, and they don't think that's really funny. So I say, you're right, not everyone needs to see a shrink, but everybody needs to see a life coach. Everybody needs assistance in something. And so if I use the analogy, if I'm a tool belt, I'm a hammer, and I'm a pretty darn good hammer. But if I'm going to put a house together and the only tool you have in your back pocket is a hammer, you are going to fail. And so my colleagues, my behavioral health consultants, my life coaches, they are the nails. And if you are really wanting to improve your health and you're really wanting to move forward, we have to work together as a team, and you need more tools in your pocket than just me. And so you need the hammer, you need the nails. This is, I'm not referring you because I can't do this, or I don't like you, or I don't want to be bothered with the fluff. It's because I need that assistance of those extra tools, and you need those assistance of those extra tools to really be able to manage your life about what's going on.